Good morning, everyone. There is a quorum in the room, so just invite you to take your seats so we can get started. Good morning, everyone, and welcome to the Community and Protective Services Committee meeting for the month of September. Before we begin, I would like to provide you with a quick update on an event that took place last week. As chair of the city's Community and Protective Services Committee, it was my privilege to attend last Friday's ceremony to honor fallen firefighters hosted by Ottawa Fire Services and the Ottawa Firefighters Community Foundation. Our city's firefighters memorial, located in Marion Dewar Plaza, is a wonderful testament to honor those firefighters we have lost and to remember those who have bravely put their lives at risk every day. One of the Ottawa Fire Service's most important responsibilities is keeping residents safe. That's why they have again this year launched their Wake Up campaign. All week they've been out in the community to encourage residents to install, test, and ensure that smoke alarms in their homes are operating. This 8-day blitz by OFS is part of an annual Wake Up campaign. The Ontario Fire Code requires a working smoke alarm on each floor of all homes and a working carbon monoxide alarm in each household that has fuel-fired appliances or an attached garage. Homeowners who need new or additional alarms are given information on how to acquire one. Homeowners who do not have any working alarms may have one immediately installed for them or be provided with new batteries. Please remember that smoke alarms save lives. On a lighter note, I would like to remind everyone that the Try It campaign is taking place next week. The City of Ottawa is offering free Try It passes from September 21st to September 27th. This is a great opportunity to test drive fitness studios or group exercises class, and I have to say I actually did one. I did a Zumba class the last time we had a Try It, so you should all be in your facilities out in the community trying out one of those classes. It's easy to give it a try. All the details, including a list of participating facilities, are available on ottawa.ca. I'd also like to take this opportunity to talk to you about the updated Spotlight events calendar. Spotlight is an online guide to what's happening in the Ottawa-Gatineau region. This events calendar contains information on local events for all ages and interests taking place across the region's diverse communities. The upgrade provides residents and visitors with simplified access, a visually dynamic interface, and the ability to locate events by region. It's more compatible with smartphones, tablets, and a wider range of web browsers. It also simplifies the task of submitting an event for contributors. I would encourage everyone to check out the new and improved Spotlight calendar. Ottawa.ca has all the details. So now we'll just turn to the agenda, which is a fairly light agenda this morning. So we'll start with the confirmation of minute 6 from August 20th. Carried? Communications as noted. Item number 1, social assistance management systems update, and Mr. Burry has Dr. Burry has an verbal update, so we'll just hold that item and return to it. And then item number 2, community partnership capital program summary of funding allocations. Can we carry that? Carried? Okay, carried on that one. So then returning to item number 1. Yes.
Sorry, just to ask, will we have an opportunity to speak to the information items previously distributed?
We don't speak to those unless someone formally lifts them. Requires two-thirds to lift them. Okay,
can I put forward a motion to lift the geese management strategy item? I had a question for staff, just a bit of a discussion.
Okay, so carried on lifting the geese management strategy. Okay, so we'll hold that then and return to it. Okay, so Dr. Burry, over to you.
Thanks very much. Good morning. The last update we provided on SAMS was in April, so there's been quite a bit of work and things that have happened in that time. And what I want to provide you this morning is a bit of a snapshot in terms of what the progress is, what were the actions that were taken that have gotten us to this particular point in time, and where we are. The province of Ontario currently has identified that we're still in the middle of largely the implementation of SAMS. We're not at a point where the product is at a point where you could consider it to be a functioning product. We're still very much in the implementation of this. So to make it simple for council to understand, I would say we're at a point where if you're introducing a new application, we're about 6 months in terms of where it should have been introduced, from the perspective of they have about 95% of the major, what they refer to as defects or bugs in the program fixed, but there's still 5% outstanding which have not been done. Beyond the bugs that are in the program, there are a number of things that impact staff in terms of their ability to do their work. There are a number of very inefficient processes that are built into this application. The province refers to those needs and repairs as enhancements, and we don't know when they will get to those. So we're at a point where the application is stable, but there's still a number of bugs and a number of things that are not functioning within it. The province recognizes that, but they have made significant progress over the summer to at least stabilize it to the point where our staff are able to get many of the functions done and serve clients. We want to make sure that, in addition, you understand that there's a tremendous amount of work that is going to go on between now and the end of next April just to work with all the various groups across Ontario who are implicated in this implementation to bring it to a level where we have a better system running in Ontario. What we did here in Ottawa, and I want to acknowledge where we were in April, was probably after March being one of the worst check runs we'd ever experienced, April being one of the most difficult months in operations. We had been building during that period a response both within the centres but also back to the province of Ontario. And I will acknowledge specifically efforts that were made at the time to assist us through Susan Jones, Pierre Poirier, Jen Montgomery, and Nancy Sanson-Booth from our emergency measures group, who actually stepped in to say, you guys are really in an emergency situation, and helped not only us, but essentially the provincial social services group build the rudimentary plan to help get us out of some of this. We also, in terms of Ottawa, recognized through those efforts that one of the things that needed to be done was to discuss about how we were going to actually build a recovery for the social services system, given that it was pretty much brought down. We were not very well functioning again by the end of April. And Colleen Hendrick and Suzanne Gloger from our group provided secretariat to the Provincial Association to put together a business recovery working group. That business recovery group produced a report that demonstrates very clearly over a number of different parameters where all the impacts in the business were, how that was impacting our staff, and how much longer it was taking to do very basic functions. The province is now using that as the template to now move forward with addressing all of these impacts. And they identified very clearly yesterday and are aware that one of the key functions, which is in taking people into social services, is greatly impacted by this. It's taking 2.5 to 3 times longer to actually complete an application for someone coming into social assistance. And that's very, very difficult for our staff to have someone in need and stress in front of you and it taking considerably longer than being able to get to the answer. Our clients rely on this. So we have 16,500 benefit units approximately who rely on this every month, over 30,000 people. So we have to get it right. And there are many things that we're doing that are ensuring that that's happening. So they're getting their payments, we're making sure they can pay their rent. All the things that they require are in place. What's not in place, and which the province has suspended for us, are many of the follow-up actions that we need to do with clients. So we're still not doing employment workshops, and we're not providing what the province refers to as outcome planning, which are more detailed discussions with clients. We cannot bring that work back on until we have some of the fundamentals in the application more stable. In other words, we're spending less time on the basic finances and getting that done and being able to actually move on our primary objective, which is to help people get off of social assistance. All of this only comes together when you have a pretty extraordinary group of people who've been working extraordinarily hard, and the management group under Marilyn Ferguson, Chris Tuck, Ann Bell, who are here today, Sonia Parno and Laura Brown have really been doing yeoman's work to try and build a management approach to this within our centres. then I think it really comes down to what happens on the ground. And we have 4 centers, one at 2525 Saint Laurent, one on Oakley Road in the East End, 25 Walkley Road, and one at Constellation. And those individuals, their team leads, coordinators, these are all key parts of making those offices work. The verification specialists, the case coordinators, the admin staff, the employment specialists, the eligibility review officers, the family support workers. Without those individuals, that's what makes the social assistance system in Ontario work. And all of those individuals have, I think, done an incredible job over this and into the summer to stabilize and to help clients and to pull together as teams to make this work for clients. One of the key things that we had talked about before was the lack of training. And there was significant lack of training going into this application, which was extremely frustrating for staff. They really were given something that they were very poorly trained to use. Again, this is another area where we're stepping up. We have 2 of our frontline staff who are directly involved with a provincial group to start saying, what is it that frontline workers need in terms of training? What tools? What should those look like? And we're also sending our own tools that we've developed here to work through this application back to Toronto so that they can use those. And we have, in terms of that, within our group, business application, what we refer to as business application specialists and LTSs. These are people who help people to use these applications on the floor, who've stepped up to do a tremendous amount of extra work on our staff's behalf. What does all this mean in terms of workload, not just for us within the department, and I want to acknowledge as well that it's not just social services or the group within the centers that are working extraordinarily hard. This has had an impact across our human resources department, finance, IT, legal. Everybody has had to step up to help us to get out of where we are and to make sure that this is stable and clients get to do this. In addition, we've had the support of council, and particularly this committee, in terms of making sure we're heard. And that was a key issue, I think, early on, and the province now is heard and is now beginning to better understand what has actually occurred. And that's why we're getting, I think, a much better proficiency in terms of their response. And they remain focused on the number one thing, is that those tremendous amounts of inefficiency that have been introduced, we need to get back to a period where they're now going to do that. And as part of their last effort is they're now looking at, again, through the advice we gave them through the business working group, time and motion, as well as other studies, to say what business processes now need to be re-engineered to actually work with this application so we get some of this proficiency and efficiency and excellent client service back. So that's my overview in terms of where we are. Again, thank you for that, and I'm happy to take any questions.
Well, thank you very much, Dr. Burry, for that. So this has been almost a year since the commencement of the implementation of the SAMS system, and yet the province is still characterizing this as an implementation phase.
We're definitely still in implementation. It's not been moved. It's still part of an independent or a separate project team. It's not been moved into routine operations at this point.
So when you talk about the 2 to 2.5 times longer it takes to input the data for a new client, that's 144 clicks every time.
So I'll give you one of our worst case examples, which would be, this is not a bug. This would be something that the province will have to fix longer term as what they would refer to as an enhancement. If for whatever reason we get information or do not get information in time for a client in any given month, there is an automatic process of putting a file into suspend, or if the information does not come in, that file will be suspended. In order to move, if that individual shows up 2 or 3 days before the end of the month and says, I now have my information, a frontline staff to go in and take that file from suspend and move it to the ability to produce the payments and do what it's supposed to do, or make an adjustment on a file, it's 140 clicks of a mouse, multiple screens. 140 clicks that's gone from about 12 clicks previously to 140. So those are the types of examples of inefficiency that have been implemented through this that will need to be fixed, and those are going to take time, is what the province is telling us.
And then it's further complicated if that's part of a family.
then it's 140 clicks times every member of the family, whereas previously it was only to change for the principal individual.
And so what happens is that's been suspended, so coming into the check issuance day, then all of these fixes have to happen, and that's what's jamming the system and causing the problems when we come into every check run.
And the workload of this, of course, is that it really makes that pay run, which used to be perhaps a couple of days before, a couple of days out, now has become the week before and the week after. So half of the month is largely tied up with just correcting and fixing and getting things done and making sure that those things go right at the end of the month.
And where are we financially in terms of the province paying for the additional costs? And what about the drag on our staff that is occurring by this prolonged period of implementation?
So as I mentioned earlier, part of the key to being able to manage this has been the province's acknowledgement of a few things. One is suspending the requirement for the department to do certain very key activities. So those key activities are just not going to happen and can't happen. That is a workload implication. Secondly is to suspend or turn off a whole bunch of functions within the application that generate other issues. Those functions are turned off. They do have some proposals to turn them on, but again, we're advocating now some propose to go on, for example, at the end of October, to say no. Do not turn those on. We're not ready for it. When you turn those on, they generate a workload that we cannot absorb. We're going to manage within the workload that we have. As I mentioned before, we're trying to reduce the drain on staff by removing work and basically making it doable. We've also, over the summer, redistributed work. We're bringing individuals. So some of the functions that we're not doing, those individuals not doing those are now devoting their time to assist their colleagues and to take on some of these functions as well. So they're doing functions that they normally would not do, or they would normally be doing other functions a lot more than they're currently doing. So we're trying to manage this within the group of staff, knowing that we're not in this for just a couple of weeks, but we're now into it essentially for considerable periods of time. It's very fluid from that perspective. The province is making changes monthly at this point to the application. It will move to quarterly at the end of November. So that does reduce some of the uncertainty, but it also will lengthen out the time we have to live with certain bugs. If we've identified them, and so we know that there's no bug fix coming for that for 3 to 4 months now.
How are we doing compared to other municipalities across the province?
There is a range in terms of where they are. When we look at the data and the information that comes in, some are struggling more than others, and some are behind where we are in terms of that organization and where we are. I attribute much of that to sort of the team collective effort that's been put in here at the city, and I can't, again, under people like our IT who have kept our servers, everything up and running. Some of the issues have been in other municipalities is not only you have issues with this, but now you have a technological blackout locally. We have not had or experienced very much of that because they've been really on it. We've gotten sort of priority treatment, if you'd like, to make sure when a server goes down or something else, it's brought back up immediately, making sure our internet connections are top A, because that's what really makes this thing work. And again, when we mention things like HR, helping us with the staffing processes, that as people are retiring or leaving, that we do have the replacements in place as quickly as we can.
Is there anything that we should or could be doing at the political level to assist you?
I think what you're looking at is now, and I hate to say the word wait, but I think we have to see where we're going to finish between now and the end of the year, and where is the province in terms of the application. There are some key functions right now that we need to see progress in. They are aware of what they are. Key areas in terms of reporting, which are not available to us. So because that reporting is not accurate or isn't working for us, we are a bit managing social assistance in what I would refer to in the blind. We don't exactly know what's going on. We can get the information, but it takes a tremendous amount of manual effort. That's, again, where our finance people and everyone else are going to have to do a great deal of effort. What our issue is that as long as the province keeps off the requirements, it allows us to manage it, and as they bring them on, that we're provided with enough notice that they're doing this, and in addition, that allows us to understand what the workload's going to be. Because as each of those elements of the social services program are brought in, they generate a workload. They also generate a need to address things that are now backlogging or building up, which are adjustments in files and so on.
Okay, thank you. Councillor Brockington.
Thank you, Madam Chair, and good morning. To Dr. Burry, what is the impact right now on social assistance recipients? Are they themselves feeling significant delays, or are things in their eyes fairly smooth?
I would say in terms of the recipient that they've come to understand that we're kind of permanently disrupted. We're not where we were, and they are seeing improvements. We do not have the issues, again, it's yeoman's effort on behalf of staff to make sure stuff doesn't go out that's incorrect. They are killing themselves to make sure those 140 clicks happen because they want what goes out to be accurate. If it's not accurate, it impacts the client. If a client gets too much money or too little, both of those things have negative aspects. I think where clients are most impacted is the amount of time that our staff have to spend with them to help resolve other types of issues. So that piece of it is not, we're nowhere near business as usual. I just want to make sure, to answer your question. So from a client's perspective, what they might have anticipated from us a year ago at this point, where we hit, when we looked at our data in terms of our customer service and turnaround, we've returned some of those areas in terms of being able to see clients for basic functions like intake within a given period of time. But the length of those times of those appointments have gone up, which means we've got more staff doing those types of things, et cetera.
I want to thank you for updating the Table 2, which looks at the direct financial impacts on our system. You had mentioned, though, that there are a number of departments within the city. You had mentioned IT, finance, HR, and others, legal, who are also involved. That's not reflected in the table, is that correct? And I think what the committee needs to be aware of is that there are these additional costs from our own staff who are already on the payroll, who are now having to defer some work to contribute to this initiative. And so we are seeing staff not being able to fully work on other projects because they're being drawn into this. So there's not just the direct costs, but other indirect costs associated with these staff. Am I correct in that?
I think it does mean that work gets put aside,
right.
And I think in terms of, particularly in our finance areas, when we're asking for certain things that we would normally be able to do in relatively short turnaround, we can't do it in short turnaround anymore. There's just information we can't provide that historically we've been able to, and I know that frustrates everyone in the system. In some instances, it is going to mean some deferred work that will come back at some point, and that's why it's a very fluid situation at this point. We're still in an implementation. We're not really in a real sort of a stable or more stable world.
Are we required to, or are you doing this on your own initiative, to update the ministry on any type of frequency about how things are going in Ottawa? And what is your understanding of their interpretation of how things are going? Do they think everything is running smoothly, or are they aware that we continue to be faced with these challenges and they're struggling to assist us like everyone else?
I guess I would say, because I speak with the Assistant Deputy Minister responsible for this fairly frequently. In terms of our involvement, I'll just run through the various groups or things that are involved. We have the Provincial Association, which represents all municipalities, is actively engaged. Peter Wolfblas is supporting this. Yesterday there was a conference call with all the senior leaders, basically in social services across the province, an update provided by the ministry, Richard Steele, the ADM. We're in constant conversation about that. Over the summer, through visits and so on, and I think what we have been able to do is improve an understanding at the ministry of how social services actually works in Ontario at the ground level when a client is in front of you. I think that knowledge was missing going into it. I think they now have it. I think they've also got a much better understanding that, man, we have really impacted business processes in the province and we need to go back. And so they are committed to doing through the various municipalities a series of works, one of them being a Lean Six process to look at all the business processes that are now not functioning very well. So basically going back to the beginning, re-engineering the business process so that it works better with the application. It's kind of the reverse of what you'd normally look at doing, but they've committed to doing that. They are committed to doing the fixes. They've got a very consolidated team. They're providing more regular updates and clear information. Still a lot outstanding, but clear information as we go through. In addition, Chris Tuck represents me on a group which is the administrators of social assistance, specifically in Ontario. They refer to that as DARG. He's the Eastern Ontario representative, and essentially we're making sure that the information is going back and forth related to that. We have staff groups working on it. In addition, our business working group, there is also a senior leaders table, and I've been invited to that. So there are essentially 5 to 6 of the commissioners in Ontario who are continuing to provide them with a more strategic high-level view as to, yes, there are certain problems, but here's what you're missing and where you need to get with this. So we are very engaged, and I would say, yes, they are definitely listening. I don't think they have any choice at this point. They're now, I think, recognizing that this likely has cost implications, and as of 2018, they own 100% of them. So it's very much in their interest to make sure that the system, the entire social assistance system, works better. I have a phone call later this morning with the new Deputy Minister for the department to talk about what the key priority and why they introduced this, which was essentially the transformation of social services in Ontario.
The last point I wanted to make, Madam Chair, is last month a delegation of councillors went to Niagara Falls at AMO. Councillor DeRuse, myself, Councillors Chernichenko, Taylor, and Hubley. And a subset of us met with the minister, Minister Jazik. I think Councillor DeRuse was there as well. And there are 2 things that I took away from that conversation, very, 15-minute conversation. Number 1 is, and Councillor Drews can correct me if I'm wrong, but I did look at my notes, is that they believe province-wide the implementation phase has more or less been addressed, province-wide, and that new money to address the implementation challenges was more or less dried out. And the second thing that was stated to us is we, the ministry, is going to reduce some of the reporting requirements by municipalities to offset that staff time and staff resources to address with the SAMS issue. And I don't know whether that's a one-for-one trade-off, because if there's no new money coming, maybe the ministry thinks, well, we'll just make sure that municipalities no longer have to report certain things, that there maybe be a timeout for 18 months, 2 years. And whatever time and resources you needed to address those things, we'll just put that all into the SAMS issue. And maybe it's easier said than done, but is that an approach that would work in Ottawa, or are we still going to have a net increase to what taxpayers are going to have to pay because of the implementation issues here still continue?
I would not anticipate that we would have local taxpayers on the hook for a provincial administration at this point. I think you would have not just this municipality, but all the municipalities seeking to renegotiate the financial arrangements. As of 2018, our commitment to this would be to administer the program on behalf of the province of Ontario, but it's their program. So they have a vested interest now. We're no longer 80 cost sharing. We will not have a sort of the old terminology for it. We will no longer have skin in the game or pay for say. It essentially is their program. So if it's not working properly and getting the objectives, it's the province of Ontario that actually wears it. If we're not able to function properly and make sure that individuals actually exit social assistance, as we've historically been doing, which is the key function, then they will continue to have a system-wide. And that's why I'm hoping through those discussions that will start this morning that they really focus on where the intent needs to be, which is modernizing or transforming how social assistance in Ontario works so that people don't stay on the system longer than absolutely necessary.
We did, City Council last week, pass a motion asking the province to cover 100% of these costs, so I look forward to the reply. But it's something that we need to keep hammering home. We did not create this mess. Our staff are valiant, continued to be valiant in their efforts to address this, to ensure that, the resident, that the social assistant recipient does not get impacted, so that needs to be applauded and appreciated and acknowledged. But it really, quite frankly, is not fair that municipalities, through their taxpayers, have to pay for the additional costs. So whatever we can do, and Madam Chair, you asked the right question, if there's anything else that staff need through this committee or council, please bring it to us, and we will be that champion as well. So thank you.
Thank you, Councillor Brockington. Anyone else? No? Received on the update? Okay. Councillor Nussbaum, Rideau River Geese Management Strategy.
I never thought I would forward a motion insisting we talk about geese, but it is an important subject, and thanks to Councillor Fleury for raising the issue earlier this summer. And I guess, Ms. Jones, I just had, maybe a question and maybe an idea for moving forward. Based on the report, your staff say that really the most effective way of dealing with this is egg addling, which is a new word that I've learned since I started this job. And that makes sense to me because it controls the population, whereas the dog hazing simply removes them temporarily, perhaps, and they go elsewhere and doesn't necessarily solve the problem. So in looking at your chart on the response, I don't think it's numbered, but it's the second to last page in the memo. You've got a bit of a budget estimate for what it would cost for 2016 and 17. And you state very clearly that the problem is you don't have the money in the budget to expand the geese management strategy to the parks that Councillor Fleury had asked about. And then just looking at the report and looking at the numbers, I'm just wondering, would it not make sense to focus on the egg management portion, which is massively cheaper? So it looks like for $5,000 you could do the egg addling in the 4 parks. And if the dog hazing isn't affordable, which I understand, then maybe abandon that portion. So maybe that's something you're already doing, but it just struck me that, the spring is the key time. If we can addle those eggs, we're going to stop the geese population from increasing. And many of the parks that Councillor Fleury has in his ward that are suffering from this are going to be beneficiaries of huge increases in population from humans next year because we have a bridge going over Donald Somerset Point on the river. So you're going to see a lot of people walking and cycling through there. So I guess my question is, would you be prepared to look at the egg management portion only as a potential expansion of the strategy for the springtime?
Through the chair to the councillor, Lila Gibbons will respond to that.
Hi, through the chair. So we do a little bit of both of the practices. The egg addling is something that we did this year as a new trial to see how that works. So that does help control the population, but we're dealing with both migratory and with resident geese. So the resident geese is the ones that are laying the eggs here in the parks. And that's when we can tackle a little bit of the problem at the front end to help control the geese population, but we also have the migratory geese that are coming through, and that's where the dog hazing or the drones come into play to help assist with moving the geese to another location during the busiest times of our season. So it is a combination of both that we need because we're dealing with different types of geese that are coming into these areas.
Thank you for that answer. And I'm not sure if this is getting into a level of specificity that you're not able to answer, but when you dog haze, is that a temporary measure where the geese return within hours of the dogs being there, or do they really, as a result of that, relocate to areas that you deem are less likely to cause conflict between humans and animals? Or are they simply, in the Rideau Vanier case, are they going from Richelieu Park to Kingsview Park and thus not really addressing the problem?
Through the chair, yes, it is a temporary measure. What it does is we have the intent that we're hoping to make the area less desirable for them to come back to, but there are other methods that we would use in that case, signs promoting people to not feed them. That brings them in. Also with barrier shrubs. So if you stop them from to have a clear view of the water, that also deters them from staying on site. So with the dogs or the drones, it is a temporary measure, but with the other measures that we want to put in place as well, we're hoping that it deters them to go to another location. And yes, sometimes it just means down the river, but that's why we're looking at tackling the 4 parks versus just 1 park at a time.
Okay, that's great. So in conclusion, you'll look at the possibility of doing the egg management in those additional parks, or, I mean, I know you mentioned Richelieu Park as being the key one, so I guess the other option, Councillor Fleury, is even if there isn't money for all 4, to prioritize a little bit, with Richelieu clearly being the most important, and that one really being one where we're going to see the increased traffic and the most benefit. So I appreciate the answer. Thank you.
Thank you, Councillor Nussbaum. Councillor Eglai.
I want to thank Councillor Nussbaum for, I didn't think I'd have questions about geese either, but it just strikes me in the backing and forth thing that if the expense, or more of the expense is related to bringing in the dogs, are these parks where the public can bring in dogs? And if so, could we not simply switch those over? I mean, and let people bring their dogs in, and that we don't spend the money on bringing in the dogs, and the geese still go away.
Through the chair, if I do believe these are either dogs on leash or no dogs parks, so we would have to get a variance to the bylaw in order to move forward with that. I would have to have conversations with bylaw to see if the best option is to allow dogs at the park. I can't answer that at this point in time.
Okay, I'm just putting that out there. I mean, if we're having a cash crunch, and this is a low-cost way to address that.
Might introduce a few other issues.
It may. It may.
Councillor Fleury.
I was just going to let the report go, and I'm happy. I understand the budget pressure, but I do see that there might be some gains in when you look at the financial breakdown to do some of the earlier proactive, more preventative approaches that are presented. I would just go back to one of the issues that brought this forward is that we had a strategy for beaches. We didn't have strategies for parks specifically. And what we noticed was along the Rideau River, so they include parks in my area, but they go in Toby's area and they expand, further south into David Chernyshenko's area and further, that we were seeing a growth in population around there. So I just want to give context. I think it's important that it's broader than the beaches. I understand why the beaches are priority to give access to the public and keeping the water clean, but beyond that, we're seeing impacts along for park use and along the pathways of the Rideau River. Thank you.
Okay, anyone else received on the report? Received. Okay, inquiries?
I do have one.
Okay, Councillor Fleury.
So I'll preface this by saying, in my mind, this goes to this committee, but I recognize it might fit in other portions. Alors, combien de centres municipaux publics avons-nous à travers la ville? Dans ces centres, quels sont les pourcentages de poubelles où on a des poubelles accessibles au grand public? Et de cela, combien de pourcentage de bacs verts avons-nous accessibles à ces mêmes endroits? Merci.
Merci. Anyone else? Councillor Kakish.
I was just wondering if we can get a quick update on the Syrian refugee issue. I know we're hosting an open house, the mayor indicated October 1st, but in terms of if staff, Dr. Berry or whoever's here that can comment in terms of what role the city would play and the potential costs associated with that, as well as what residents can do, because we're receiving a lot of emails about how can we help, and if there's any preliminary discussions that we can know about, that would be great.
Okay, I don't think Dr. Burry knew this question was coming, so I'm not sure he's in a position to answer it right now. But Dr. Burry, I'm not sure you heard the question, but it was basically asking for an update on the Syrian refugee issue and the role.
This is an added item because you would have to add it to the agenda.
Is this other business?
We still have to add it to
We still, okay, so carry it on adding it to the agenda?
Carrie.
Okay. So, Dr. Brewer, are you in a position to answer that right now, or could it just be direction that you could provide us an update at council? Or what would you prefer?
I think, well, what do you prefer? Pick your poison? No, I'm sorry about that. Essentially what my crew is doing is we're supporting the mayor's initiative, which is to organize and help support the forum, to bring together various community stakeholders who are working with, who are already actively engaged or will be engaged in terms of bringing Syrian refugees to Canada. I know many of these groups, I know these individuals, I know they've been actively engaged, so it's basically, I think, to bring them together to understand how the processes work, challenges, as well as how else to sponsor additional individuals coming to Ottawa.
And will there be more reporting in terms of what this entails for our staff in terms of costs, or what role we would play as a city in terms of bringing these refugees in, if obviously the federal government proceeds in that direction?
So in terms of what this ultimately means, it's kind of a complex sort of series of events. It will depend on typically what the federal government does in terms of its refugee program and the status that it gives individuals when they come into the country. So the sponsorship group are largely sponsored through individuals and private donations to support them for a period of time and bring them into the country, help them with education and so on. That's where I meant earlier in terms of I am familiar with some of these groups, and they do come forward with various requests, and we help them to coordinate and reduce the costs of being able to do that. That's more on a personal level rather than on a systemic level. Ultimately, where I think the costs or the challenges for our community are things like programs English like a second language, helping people to assimilate locally. It does put a certain amount of pressure on those community-based programs that deliver things to help refugees integrate into our community. And again, the funding does not come from the city to do that. It comes typically federally, and that's where the group, so what I would be looking at is if you're going to bring X number of people into Ottawa, what is more the impact for our community partners, which would be Catholic Immigrant Services, the other immigrant-serving community, English as a second language. They are the first front line who generally experience it in the short term. In the medium to longer term, it's at the point that either individuals brought in as refugees, if they come in as refugees with no sponsors, where the federal government essentially cuts them loose and says you're no longer federal responsibility, now go to the province, which means they now come into the social assistance system. That's not going to happen immediately. Those uploads typically come downstream, and it would be easier to predict that once we know how many individuals are potentially coming into the social assistance system in the future.
Okay. Thank you, Dr. Bain. Thank you, chairs. We have been getting a few emails on this, and people obviously want to help out, but I think it's also important, although it's preliminary at this point, what role the city would play and in terms of any costs that may be associated with that as well. So thanks, Chair.
Okay, so maybe we could ask that you continue to keep us updated on that as information becomes available.
Absolutely.
Thank you. Councillor Nussbaum.
Thank you, Councillor Kakish, for adding this to our agenda. I think it's obviously a timely issue. Just a question for staff. Do we have historic data on the percentage of Canadian-arrived refugees or asylum seekers who succeed in achieving refugee status that end up in Ottawa? I mean, is there a rough, if you look over the historical period, is that something you happen to know off the top of your head? If not, no worries.
Definitely don't know it off the top of my head. There's been some significant changes in the way the federal government operates with respect to refugees, but certainly there's keep in mind we have individuals coming from South America, we have individuals coming from all over the world, essentially into Canada, who come in as refugees. And so we do now have an increase in the number in terms of, because of the disruptions happening in Syria and elsewhere. But we do have on a daily basis, essentially, if you look at our caseload, individuals moving out of the system, those are new individuals coming to Canada to settle. The federal government has changed its policies in recent years, and we did see a significant decline in the numbers of individuals coming into our service. That's why our numbers are largely not increasing dramatically as they might anticipate at certain periods, largely because the immigrants that are coming in are now more of the economic class and less of those who are essentially refugees. And it's hard to distinguish between people coming from immigration versus refugee. Refugees typical examples, they're in Pearson yesterday and they arrive here today. And those do happen, largely because there are family members here, but they do come, and essentially now the province of Ontario, or the federal government, provides them status and they immediately move into the social services system.
Thanks.
Anyone else? So thank you. Councillor Kakish received. And before we leave, I do actually have one item that I too wish to add to the agenda under other business. And basically it's a letter that came to me from the Coalition of Community Health and Resource Centres. We have a major capital partnership program that has $300,000. It's a 75-25 cost sharing, so the municipality's contribution is 25%, and the Community Health and Resource Centre's contribution for major capital works is 75%. So the letter that they sent to me yesterday, and can we just carry that? We can put this on the agenda. Yeah. Okay. Thanks. The letter that they sent to me yesterday indicates that they're in such a financial tight situation that they are unable to access the funds because they can't come up with the 75%. So obviously this is going to result in the underutilization of this program unless we have some flexibility. So the direction, Dr. Burry, that I want to give to you is to provide flexibility in utilizing that program to ensure, even if it's a 50-50 cost sharing, that they're able to access the funds that are available for their capital works. And I guess the question to you is that enough direction, or do I need to put a motion either here or at council to formally achieve that?
I think, Chair, my understanding is that it should be sufficient direction for now to make sure that that flexibility is essentially used this year. What we will be doing is we will be bringing back which we grant some contribution policies and directives at some point during the term of council. We're required to do this. We intended to make these adjustments in that report when we brought it forward, recognizing that at the time the program was created in the early 2000s, that essentially a 25% from the contribution from the city allowed the community resources to leverage 75% from other levels of government and or other agencies. Clearly those other funding sources are moving closer to 50-50 or lesser, and so we need to update our policy to reflect that. We were certainly in agreement with this with discussions. It's really just now be a technical for us to be bringing it back. So I think the direction would cover us for this year and get us through the process. Which,
and I could report back to them that you now have the direction that you need to go ahead and have some flexibility in assigning those dollars.
Yes, that would be excellent, and that will allow them to complete their applications by September 30th.
Okay, thank you, Dr. Bird. Councillor Eglai.
I think it's great direction, but I'd like a little bit more certainty around it. So are we going from 75 to what? Just so everybody's
what they're essentially asking for this year, we would do it on a case-by-case basis, but essentially they're looking at approximately 50-50 at this particular point in time. If someone had, rather than saying, well, it has to be 50-50, they've got 45-55, we'd kind of like, it's those types of gray area. We need a little bit of flexibility to bring that back, and then we would largely look at wording in the new policy that would allow that level of flexibility rather than hard target. It's not that they're not coming up with anything. They have monies. They're able to do what they're intended to do, which is in partnership. It's just that the barrier of a 75% at this point is pretty heavy, given how other funders have changed what they're willing to match on capital funds.
I guess my concern long term, though, is this a blip, or is this a trend? Because if it's a blip and we switch it from 75, we're going to end up participating in less projects overall. That's just my concern in going forward with this.
And I think we had that discussion, I've had that discussion with them, and for this particular year, given that there are a series of smaller level projects, so they're leveraging the $300,000 towards a series of smaller level projects. One of the things that we do with this particular group is they actually assist in assessing what are the highest priorities in terms of investment across the community. So it's a very efficient process that they've developed, and I have to thank the EDs, the executive directors, who've put this together so that we're in fact not getting a whole raft of applications from all of them that total millions and millions of dollars of which we really can't fund it. That becomes, to me, silly work. They've been very good at this, and generally what they submit is very well detailed. It is very clear in terms of how that benefits priorities. And they've also acknowledged there will be other projects, where particularly large ones, where the $300,000 would potentially go entirely towards it as a 25%, because in many cases they've actually over-exceeded the 25% previously. Or 75%. They've often come in with 95% of the dollars on some of those projects. So they really understand that it's a leveraged fund. That's the intent, and we want to make sure that it would maintain that. That's the policy currently. It's just the percentages were hardwired back in 2001, and now, 2015, it doesn't make a lot of sense to continue doing that.
Okay, thank you.
Anyone else? Okay, received. Any other new business?